Hi everyone, this is Ruth from Sunrise Well, and I'm here with Adele Stewart. And before we get started, Adele would like to begin with a quick meditation. So, shall we begin with that, Adele? Are you happy to start straight away with that?
Yeah, thanks, Ruth. Just closing the eyes or having them downward and just checking in, see what's present at the moment. Sort of what's the nature of thoughts, any sort of moods that are present, emotional tone, and sensations in the body. Not needing to change anything that's present, just putting the welcome mat out, allowing it to be. Maybe following about 3 to 5 cycles of breath. No need to control or manipulate. We're not imagining or analyzing, just being with the breath as it comes in and out for a few cycles. And then gently externalizing the awareness by noticing all the senses. So the sense of touch, body, wherever you're sitting, clothes and air, jewelry, hair. Notice any tastes or smells that might be present. A sense of hearing my voice and anything in your environment. What you can see behind the closed eyelids. And then, when you're ready, gently opening the eyes, taking in your device as well as the room around you. Hmm,
Hmm.
Thank
Hmm.
you. I know.
Thank you. That was nice. That was really a nice way to start. Um, yeah. So Yeah, Adele, you told me briefly that you're a GP
Mhm.
and you're a mindfulness-based stress reduction teacher, and you work out of your medical
That's right.
centre
Yeah.
with MBSR.
Yeah, I
Yep.
do. So
Yep.
yeah, I'm a practice owner. I've been there for nearly 30 years.
Mhm.
And in the last few years, we've got a nice, generously sized waiting room. So and it's quite a nice room. It's not like a horrible doctor's waiting room.
Mhm.
And on a Saturday afternoon, when the practice is closed, then we run the MBSR. Of course, I haven't the last term because of COVID, of course, but I
Mhm.
did first one this year and planning to run another one end of July.
Mhm. Okay. Okay. And yeah, can you just tell me a little of your background aside from those few things?
So I did my first meditation retreat many years ago when I was 21. I'm 54 now,
Mhm.
um, and I didn't. I actually found it extremely difficult and thought that I'd probably never meditate again. But it
Right.
must have planted some some seeds there. And then probably about 15 years ago, as it as is often the case, difficult times in my life, I turned to meditation and mindfulness again, and got
Mhm.
sort of progressively more interested. And yeah, eventually a few years ago, actually I'd come across MBSR and John Kabat-Zinn once again, maybe 15 years ago, and I remember thinking, oh, I'd love to teach that. And then it took
Mhm.
me probably 12 years before I eventually did it. And I love it. I really do. I don't. It doesn't feel like work at all. I find it very enjoyable and got the lovely sense of connection and very energizing.
Mhm.
Yeah.
Mhm. Yeah. Yeah. And did you explore that in your own personal practice as well? I guess at the same time as taking it up in your teaching.
Oh, absolutely. I mean, I think I'm sure you are aware, that's one of the most critical things about being a good mindfulness teacher is applying it yourself.
Yeah.
So by the time I taught, I'd done many sort of 7-day type silent meditation retreats. And I did the MBSR course myself twice
Mhm.
before the teaching. Yeah,
Mhm. Yeah.
definitely.
Yeah. Okay. Yeah. And so I guess it's quite interesting to look at it from your being with your medical background. Do you find your students
Mm.
come through because you're doing your classes out of the clinic? Do you find that the students are coming from the fact that they've already been visiting the centre a lot of the time,
Yeah,
like from medical
certainly
issues, I
the
guess?
first. Yes, so the first couple of courses, they were almost all practice patients where
Mm,
either I was their doctor or one of the other doctors had recommended it.
mm,
And there was certainly, I probably was lucky in that I would attract patients who wouldn't normally do something like mindfulness because they saw it as a bit hippy dippy. But because I was a
yeah.
sort of, you know, GP, I had those sort of qualifications, they had that sort of trust. And I think a
Mm,
few of them are actually a bit taken back that I was quite different in my MBSR sessions than I was as my sort of doctor persona.
mhm.
Um,
Mm,
you know, after and some initial skepticism, I mean, there's always people that, of course, it doesn't work for, but or doesn't work out for. It's not the right time.
mm,
But
mm,
vast majority, yeah, finish the course, get tons out of it. Get a lot of people repeating it because people tend to get sort of different layers from it. And then
mm,
then word of mouth's been great. So lately, it's probably been less than half practice patients, and others word of mouth from other doctors in the area or psychologists or people who have just searched on the Open Ground website, which is the organisation that I'm an associate of.
oh, right. Okay. Yeah. Okay.
Mm.
Cool. Yeah. So, and do you find, since you've been practicing, or since you've been teaching, I should say, particular themes coming up in the students that are attending, like what they're looking for, or what kind of issues they're coming to the course with, in terms of what they might be hoping to achieve or fix, or all that sort of thing that people might have a motivation to join a class like that.
Yeah, I mean, I think what comes through is that we're all suffering in the same sorts of ways. So they're
Mhm.
very, very common things. I mean, there's people with pain, chronic pain,
Mm.
um, depression, anxiety, um,
Mm.
very stressful times in their lives, and I think there's always that sense of, often even on the first session, people telling just a little bit of their story, and people are like, oh, you it's not just me, and that can be a big part of the process, for
Mm.
sure. There's
Mm.
this probably a small percentage of people who are interested in teaching mindfulness, and maybe there might
Okay.
be a couple, two or three in each group that might be interested in teaching, either sort of they're teachers that are doing something at school, or they would like to teach MBSR or mindfulness in some other sort of area. As I was encouraged, I encouraged them to really be doing it for themselves to start with,
Right.
before they teach. Yeah.
Yeah. Right. So in that respect, sorry, I'm getting some feedback in my ears. In that respect, you would get, like, you would suggest to them to ground themselves in the practice, and sort of understand how it works, or what the benefits are for them first, before teaching it to others.
Yeah. Absolutely cannot put enough emphasis on how important that is, to 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 be completely embodying the practice yourself uh, before you can teach. And in fact, I don't know if people always realize that whenever I guide a meditation, I'm doing the meditation.
Mhm.
I'm not I'm not reading a script. I'm not um, thinking
Mhm.
about other people. I'm actually doing it, and if there are other people there, that I sort of hopefully am connecting to them at some sort of level.
Yeah, yeah, yeah. No, that's really nice. Yeah, yeah. And I guess if you're able to do that, then I guess firstly you can transmit. Hopefully that it does transmit because you're embodying it. It's able to reach people more clearly.
Hmm.
Um, but then it's as you said, like rather than being up here while you're doing it, you're sort of fully in it instead.
Yeah, yeah.
Yeah.
And if that's obviously what we're also as mindfulness teachers trying to teach, is this embodiment, which is this
Mm.
sort of term that people are a bit like,
What
and
does
if
that mean?
so we're embodying it in practice, then that role modeling is big. Yeah.
Mhm. Yeah, yeah. Okay, cool. And so, how do you make meditation fit in your life now, and even at the beginning when you first started out? Like, how did it flow into your routine? Making it fit.
I mean, look, I think when you've got young children, I think you've got young children, haven't you?
I've got a
I
three and
think
a
it
half,
is.
yeah, a 3.5-year-old and another one on the way. So yeah,
Yeah, that's so challenging. So when my
yes.
children are 21 and 19, okay, so when my children were very little, I used to, if I could do a yoga class a week, I was so happy. That was
Yeah.
about it. But I do have people come to my sessions who do have young children, and I have so much admiration for them.
Mhm.
But yeah, since I've been meditating, I am very diligent with my meditation. So
Yeah.
I've sort of um, I would meditate about 45 minutes a day, and it would be very, very rare for me to miss a day.
Mhm.
Um, and I also do daily yoga and some sort of qigong type practice.
Mhm.
Um, and I do, like, within my work, I'm often sort of guiding little meditations. Obviously, there's MBSR, but there's also I do ACT therapy, which is acceptance and commitment
Mhm.
therapy, which
Mhm.
is a very mindfulness based process, and do some IFS, which is internal family systems, which is,
Okay.
they don't really call it mindfulness, but it really is mindfulness as well. So I'm so lucky, and that so much of what I do is mindfulness. So it's very,
Mm.
very very much in my life, but I am in a lucky situation that my children have grown up, and my husband's a bit
Mhm.
of a domestic god, so that's handy
Oh,
as well.
wow. Wow.
Yeah,
That's really lucky.
very, yeah. So
um,
I'm not that hard on other people when they can't necessarily manage as much meditation as they'd like.
yeah. Okay. And when things were busier in terms of, having your kids when they were younger and all of that, or just other demands maybe, what did you do then? Did you just try to fit it in somehow, or were there days where you couldn't make it to practice?
Yeah.
Or,
I mean, there was that one of the things that got me into wanting something, my type of suffering, was that I had fibromyalgia, which is a sort of
uh-huh.
chronic pain condition, and that affected me with a lot of pain and a lot of fatigue. So during those times, I'm delighted to say in the past 6 years I'm probably 98% better.
Uh-huh.
But back in those days, I would be, if I might need to lie down for my meditation, or I might lie in bed in the morning and do it. I'd do sort of very, very gentle yoga. And if I would congratulate myself if I could do a few minutes.
Mm.
And I, I I also used to do quite a bit of yoga nidra,
Mhm.
which is different to the mindfulness. It really is. It's a sort of more of
Mm.
a relaxation, but it was a real lifeline for me back then. I can't think of the last time I've done it now, but I did it a lot.
Mm.
So I guess there's that thing of finding what's right for you at your time of
What
the,
what
your
you
life.
need. Yeah, yeah, yeah. Yeah, and being open as well, I guess, to what's available. I mean,
Yeah,
sometimes
yeah,
we can get a little bit hung up on this is the practice and this is the only way, and then maybe opening up to, oh, maybe today instead of my normal practice, I'll do some, loving kindness meditation or a yoga nidra because I think I
yeah,
need that right now. Yeah,
yeah.
yeah,
Absolutely.
yeah.
Yeah,
Okay.
I think that's really important, and with you mentioning the loving kindness, not being too harsh on yourself when
Mm,
uh, you've had a bad day and it just
it's just not
hasn't
working.
happened.
Yeah,
Yeah.
yeah. Yeah, yeah, and I think that can be really hard when you have had a good experience or you're in a kind of a rhythm in your life where you are having pretty good meditations consistently and then
Mm,
something goes on or you're just having a hard week or something and you can't get
mm,
there and yeah, that's sort of lowering. I was talking with this in my group actually not long ago about your expectation, and not necessarily having an expectation that when you sit down that it's going to be the same every single time.
and that's so
Mm.
important too. Like, yes, if you actually get on the stool, I mean, I say to my students that, I mean, I still go through days on end where I drop off to sleep about 15
Mm.
times in my 45-minute meditation.
Mm.
Um,
Yeah.
so that sort of kindness towards that of just like, oh, that's interesting. I wonder what's going on in my system. That's always been my default, the fall asleep option.
Mm.
Um,
Mm.
no, and there might have been times gone past where I would have curled up and fallen asleep, but I have done enough meditation now to be able to stay on my kneeling stool and just notice the sensations of dropping off to sleep and coming back again, and maybe noticing what thoughts are underneath that's those sensations of drowsiness. That sort
Mm.
of notice. Yeah.
Yeah. Okay. Yeah. And in the last sort of 8 to 12 weeks with everything going on in the world, have you noticed any themes coming up with either maybe the clients, maybe the people you've been in contact with, or maybe just around the world, conversations that you're noticing and things like that.
Mm.
What have you noticed in terms of how
Well,
people are
I mean,
feeling?
it's it's been pretty impressive that we've talked all this time and haven't brought it up, isn't it? I mean, it's
Yeah,
pretty
it's
amazing because it's
amazing, refreshing.
pretty full on. Yeah, so
Yeah.
at my work, it's had a absolutely enormous impact on the way we
Mm.
practice doing telehealth.
Oh, of course,
The
yeah.
the high levels of anxiety amongst us doctors and the nurses.
Mhm.
Certainly, in the first few weeks, I was sitting with anxiety constantly, waking up with it,
Mhm.
working throughout the day with it, trying to reframe it as, well, it's getting me to notice my body and be mindful, which did, it did help. And just, yeah, all the sort of changes in the world. And once again, for me, feeling really fortunate that I don't have young children. Oh my
Mhm.
goodness, thought of
Mm.
the thought of homeschooling or not having had my trusty babysitter just
Yeah,
um,
yeah.
makes me break out into a cold sweat. And people
Yeah.
who are living in, I've come across 2 or 3 horrible domestic violence type of situations that have been really exacerbated by COVID, and people
Mm.
who already been anxious whose anxiety is really, really heightened.
Mhm.
Um, but there I know some people get really annoyed when you find the silver linings in something horrendous like a pandemic. But there are little sort of things,
Mm.
there's sort of people looking at their lives and more, maybe some people having more time though. I'm well aware that there's, for some people, that's just simply not true.
Mm.
Um,
Mm.
but this whole Zoom technology, like here I am talking to you, I'm in Wollongong in the Illawarra in New South
Mhm.
Wales, and you're in Brisbane, I believe.
Yeah. Yeah.
And just before dinner, I finished a yoga class with this lovely lady who's with Insight Meditation in Melbourne,
Okay.
on Zoom. So, so there's that nice side of things.
Yeah.
And just really a lot of people having a bit of a look at their life, I guess,
Mm.
closer.
Yeah. There's sort of a sort of a. I wonder, in some ways, there seems to be a lot of speeding up and hectic kind of balancing of kids and all of, working from home and all the family and everything. But there's also this slowing down of not being able to go and do all those things that took all the time, and maybe just that sense of being at home, more time actually observing and being with the children, or spending more time with your partner, or
Yeah.
for me myself, I think I found me and my husband had to have a lot of conversations at the beginning around, what do I need from this? What do I need from you right now? What do we both need from each other to help this to work out? And so different kinds of conversations come up. Mm.
Yeah, and I think it's really important to acknowledge that there's lots of different people in really different positions. So once
Mm.
again, I feel really fortunate. And then you look at somebody who's in Italy or New York,
Mm-hmm.
and how much incredible suffering's going on there. So really, we are very fortunate in Australia. Yet our lives have been turned upside down too. So very, very different effects for everyone.
Very
And I
different.
think we're just very careful about what I have to be careful about what I expect from others, because they can be in quite different positions from myself.
Yeah, and looking at things in an entirely different way. Yeah.
Yeah.
Mm.
Yeah.
Mm. Yeah. Okay. Well, do you have any advice for people who are really struggling right now in terms of, like, as a meditation teacher? Is there anything that you would recommend at this point in time?
I think it's a great time to reach out and get some sort of therapy. Um,
Mm.
like, I mean, I'm a big believer in therapy for everyone, really. I don't think there's
Right.
anyone that can't benefit from it.
Actually, you just reminded me of an interview I was listening to where there was a psychiatrist he's written a book called I think it's called Life is Trauma, or something, like basically saying like everybody has something that they need to deal with.
Yeah.
Really.
Yeah.
Yeah.
Yeah. So I mean, that, and there's so many people offering things via Zoom. So that could be something to do. And I think there's quite a lot of people do some free offerings, like since the bushfires and now the COVID. Unfortunately, that's probably not much practical help, because I'm not sure actually how you would find that out. But I'd imagine if you Googled, you probably could. Though later, if you post this interview, I'll see if I can find any resources to maybe put links for that.
Yeah. I was just talking with someone recently, like I know some of the bigger meditation organizations like Headspace are offering free things, and I guess I think various organizations, I guess they have little offerings going on. So maybe Googling like free mindfulness or free meditation might come up with something.
Yeah, and I know Open Ground are doing a lot of online things at the moment, and the cost is much lower than usual, and there's always sort of scholarships available. I'm not doing I'm not doing MBSR via Zoom. I'm going to start it in person because luckily we've got a really nice big waiting room, so I can fit up to 15 people in it with the restrictions. But yeah, I think most of the teachers in Open Ground, I think very soon are starting another set of MBSR. So that would be a good possible resource.
Okay, great. Yeah, I'll put some links below when I post this up. Which actually there'll be a bit of a delay, as I said, but still.
That's true.
I'm pretty sure there'll be still things available for quite a long time. So.
It would be delightful to think that in a couple of months' time that everything was back to pre-pandemic, but I think that's highly unlikely. So, that would be useful.
Well,
I've got some Go on.
Oh, sorry. What was the last part?
I was going to say I've got some meditations on Insight Timer as well.
Good.
Do a search for Adele Stewart. If anyone is interested in giving them a go,
I love hearing new meditations. I'll grab the link and put it below as well once I post this up. And thank you, Adele. I have to charge my batteries, but I'm going to just stop recording here. But I'm just going to take my laptop over and charge it. But thank you for the interview and thank you for coming along and sharing. It's been really nice to get to know you. And